This webinar, Preparing Faculty for the IEP Curriculum, Transforming the Learning Landscape, was presented at the 2013 ADIA Annual Session in Exhibition in March 2013 and was one of the top-rated educational sessions at the annual session. For the webinar this morning, we have two presenters, Professor Laura McDonald, Assistant Professor in the Faculty of Dentistry at the University of Manitoba, and also joining us today, Dr. Anthony Iacopino, Dean of the Faculty of Dentistry at the University of Manitoba. In addition to Professor McDonald and Dr. Iacopino, they want to recognize their colleagues, Dr. Ruby Gurompre, and Professor of Geriatric Pharmacy in the Faculty of Pharmacy, and also Dr. Douglas Brothwell, Associate Dean in the Faculty of Dentistry, who work with them closely on interprofessional education initiatives and collectively presented this session with them during the 2013 ADIA Annual Session in Exhibition. Now it's my pleasure to turn things over to Laura. The program is yours.
Hello, welcome everybody. We're very excited to have you join us. I have a poll question here that it was sort of a way of introducing ourselves, and I was wondering what your thoughts were. You go ahead and check all that apply that you think is the purpose around interprofessional education for interprofessional collaborative person-centered practice. And then we'll see what your responses are, and we'll be able to get an idea of where people are at. And I guess we'll just stop the poll there. That's interesting. I think everybody, the first 4 items, enhancing quality care, betters workplace experience for health professionals, promotes full scope of practice for health professionals, and improves outcomes of care are all very much the focus of interprofessional education for interprofessional collaborative person-centered practice. The area around reducing education costs is a maybe question mark, who knows, but perhaps the long-term outcome of the reducing of the education costs is all of the reasons above, the 4 reasons above, meaning that we do improve outcomes of care, better the workplace experience, and enhance quality care for one and all. So today's workshop session, we're going to focus in on 3 learning objectives, basically discuss faculty role in infusing interprofessional learning, opportunities in the health professional curricula, reflect on interprofessional opportunities that are really based on interprofessional educational learning, and then hopefully provide you with ideas around drafting an interprofessional learning opportunity or event. We have another poll here, and it's about what your experience is in facilitating interprofessional education. What have you done in terms of preparing yourself? So I think we'll let that poll go on, and I think I can advance the slide. So I can move this over here. Sorry, there we go. And we also have a second poll here, and it's again around how many interprofessional learning opportunities you've facilitated, actually, whether it's 1 or 2, 3 to 5, greater than 5, and your confidence ability in order to create an interprofessional learning opportunity with at least one other health professional unit, because the definition of interprofessional education is when 2 or more, so 2 different health professionals coming together basically constitutes an interprofessional event. So I'm going to advance the slide there as well. Interesting. So we'll stop the poll here. And good. So some good experience and some interesting experience around didactic sessions, interactive ones, it's good. Case-based simulation, those ones are kind of tough because they do require a lot more time and effort into doing them. And then the self-development, there is increasingly more and more resources that are out there on interprofessional education for us all. So at the University of Manitoba, we do have an interprofessional initiative. It's a very formal, structured one, and it's been active for several years now. We are led by a mission, which is to graduate health professionals prepared to manage and adapt with interprofessional teams, focusing on the person or family-centered health and wellness. And we're going to achieve this and are achieving this through innovative learning opportunities for the students and then, of course, faculty that support it. And we have this vision that in the end we will be able to improve health and well-being for Manitobans by building a culture of interprofessional education and practice. We really very much are focusing in on the Canadian Interprofessional Health Collaborative Competencies. This framework came out almost at the same time that our IPE initiative also was established here at the University of Manitoba. And we have 6 competencies that we work towards: role clarification, interprofessional conflict resolution, team functioning, collaborative leadership, patient-centered or person-centered care, and interprofessional communication. And the key here is that in front of all of these competencies is the context of interprofessional, because although many of our curricula addresses conflict resolution, leadership, team functioning, communication, patient-centeredness, we tend to do it in our own silos and not in an interprofessional fashion. So this model here really does ground our initiative in interprofessional education. Now, the American model is very similar to it, and you have 4 competencies in terms of interprofessional collaborative competencies. We have the values and ethics, roles and responsibility, communication, and teamwork. Inside here are the other 2 ones that we have identified separately. So we have the 6, but you will note, if you look at into the detail of your descriptors of these domains, that they also encompass the other 2 that the Canadian model has. So we're very much in line with each other across the borders. At the University of Manitoba, and in the spirit of the IDEA theme of March session, it was landscapes of learning, and so we sort of came up with this sort of visual that really emphasized what we were thinking about. We knew that we had fertile land here at the University of Manitoba. We were very much grounded in the evidence base that supports this initiative: global health paradigm shifting, top-down support, mission statements and alignment, supporting accreditation, evidence-based curricula, and professional standards that all really definitely support interprofessional education for interprofessional collaboration. And so within that, we were able to really develop and grow our interprofessional initiative, develop tools, equipment, and really focusing on assessment and evaluation and cultivation of anything that we do around this grounded theory in interprofessional education. We also have a tremendous leadership by Ruby Gros-Monpré, who's recognized internationally, lucky for us, because of her work in interprofessional education and person-centered practice. So one of the things that she really led us in was that it was important for our university, in collaboration with our regional health authority, to develop a competency learning continuum. So we've taken each one of the competencies and their sub-competencies, and we've mapped it to what we think in the end of our curriculum we would be expecting our students to be able to reach in terms of the competencies. So you see, the University of Manitoba has, for example, established interprofessional teamwork communication principles. We feel that our curricula, that we would be able to have the students reach a competent level, whereas with the Winnipeg Regional Health Authority, they would take it further and expect from their professional development unit to develop proficient and skilled individuals in terms of establishing interprofessional team communication. So in this way, you can see we worked in partnership with what we think we could provide for entry to practice and what the Winnipeg Regional Health Authority would pick up from where we ended up. So in this way, we definitely had a shared leadership perspective, very important in terms of education and practice. We also came across the University of Toronto, and we have to have big hats off to the University of Toronto because they developed a kind of rubric of sorts that is good for evaluating your event. And if you can see, it's based on process and content, and it gives points to process around a process associated with interprofessional education and content associated, and you end up with different points. So I'll just show you here. Like if we have process level of interactivity and you have a large group discussion and you have a facilitator ratio of maybe 2 to 3 students and one facilitator, or 2 or 3 groups and one facilitator, and you offer formal training to those facilitators, and you bring the number of professions from maybe 3 different academic units, and you have them together 2 or 4 times, you're going to end up with a certain score in terms of the process. that was consistent with interprofessional education. In terms of content, regarding realistic or authentic learning, you can talk or have dialogue. That would earn you 5 points. If you had explicit interprofessional learning objectives, you'd have another 5 points. If you used uni-professional facilitated debriefing after the event, you'd get 5 points. And if you used a case-based presentation versus maybe a study, you'd get 5 points instead of 10. And then you add these points up. So in the first area, 35 points for process, 20 points for content, earns you 55 points. And that 55 points gives you a green go-ahead, and you're doing pretty darn good in terms of an interprofessional learning opportunity with a high score. So we use this constantly, and we're currently in the process of writing up a paper to illustrate how we use it. And really very important in our university to enable faculty development around interprofessional education is that we do have a very organized structure with a steering committee, a coordinator, this is Ruby here, with a support staff to support her, liaison committee with representation from each academic unit, of which there are 13. And then we have working groups, faculty development working group, which I chair, team communication, health promotion, etc. Here is a very important part, this top-down support. And this is Tony Jacopino here, and he's our dean. And right from the very get-go of our initiative, Tony really led the way around interprofessional education. And I'm going to introduce Tony now. Tony, it's yours.
Thank you, Laura. Tony here. I talked a lot at the ADIA meeting about the role of the dean and about structure and about accreditation and accreditation standards, because I think it's very important for faculty members that want to be involved in interprofessional education to have the support of their dean and to make sure that their dean is very proactive at the university level and beyond to ensure that oral health and dentistry is front and center in all of the development plans for interprofessional care, and that dentistry, in fact, becomes a portal of entry into the primary care system. And it's very important as a content of integrated care plans where oral health is integrated in a total patient care plan and in concert with physicians, with nurses, with pharmacists, etc., in its rightful place in the treatment sequence. So I've actually now become and we've merged all of our professional schools. We now have one faculty of health sciences with professional colleges of medicine, dentistry, nursing, and pharmacy. And I, on the council of deans of that faculty of health sciences, I've been assigned the entire university portfolio for interprofessional education. So basically what you have is you have the dean of the College of Dentistry that is going to be the person at the top for interprofessional education within the university and our community partnerships. And one of the things that is able to happen because of that is that you have as one of the initial threads in our content areas oral and systemic health. And so if you want to make sure that dentistry and oral health is represented, you've got to be involved in the structure. You've got to make sure that your dean is a major participant in that and is connected in the inputs in the right places. So with regard to overall steering committees, with leadership of the initiative, creating the vision, linking all the pieces together, the dean has to be there. So strongly encourage your dean to become knowledgeable and active in interprofessional education so that as faculty members you have the landscape that you need to be successful. So I came to Manitoba over 7 years ago now, and one of the reasons why I came is because of the interprofessional education that was very highly developed. They weren't just talking about it, they were actually doing it. And with regard to structure, some of the things that you need to look for in your universities and in your institutions for sustainability and success, I like to think of it this way, and I'd like to thank Laura for helping me pull together this little wheel here. And basically it consists of a few parts. With resources, these are resources from the university at the university level, resources that each academic unit in the health professions will dedicate and put aside to make sure that the initiatives are well supported and the faculty members involved are well supported, and external funding. The Canadian healthcare system and Canadian government has a lot at stake in this, and we're very early adopters of funding for this, because the way that the federalized healthcare system is set up, they're responsible for all the costs, and they want to be saving money, and they want to be looking at innovations that restructure the healthcare system so that prevention and oral care on the front end are going to save a lot of money on medical care and chronic inflammatory diseases on the back end. So we've been very fortunate with regard to the amount of government funding that comes in Canada for these kinds of things. The infrastructure, again, having an overall steering committee, having liaisons from each of the health professions school that are dedicated champions and well supported by their faculties to assume this role, working groups for each of the content areas and for the different competencies that need to be translated for the participants and the students. Very important to have infrastructure for IT and a website. Comprehensive website that keeps everybody informed with regard to the activities that are happening and things that are important for people to know. Again, faculty champions within each faculty, especially on the curriculum committees, because you do have stress points with regard to curriculum and time that's available, and you have to coordinate between different health profession schools in order to get the students together in their learning opportunities and their clinical placements. Faculty development is probably the most important plan, training and preparing faculty to facilitate interprofessional learning activities. And again, very important that dentistry and dental hygiene have faculty members that are well integrated into the faculty development pipeline. We've been very fortunate here, especially with our hygiene faculty like Laura, to play a major role in this infrastructure at the university level. Again, with involvement comes influence, and that's something that you need to have. Clinical facilities, there has to be specific management of facilities set up to support interprofessional learning experiences. The student and faculty placements have to be set up to make sure that they are in facilities that are amenable to the cooperative working together around patient care. And healthcare systems and healthcare facilities in the community, the teaching hospitals and the other things have to be strong partners, because that inevitably is where the most meaningful clinical facilities are going to be structured. Again, foundational material and facilitator guides for faculty that are working with students, group sessions for facilitators so that people are calibrated and on the same page with regard to how the activities will be structured and monitored. Clinical capstone experiences that bring together information from other settings around a patient scenario are very important. And again, a comprehensive curriculum that's really tied together across the health professional schools has to be something that is created. And finally, evaluation and fine-tuning are the most important parts for us. That's a lot of what we do right now, looks to see how we're doing with regard to what students are coming away with regard to how patients are being treated and how practice patterns are changing in the community. And again, faculty from dentistry and hygiene playing a major role in that infrastructure is very important for us. This is just a snapshot of our interprofessional education website at our university. It's got a whole bunch of information there for people, students, faculty members, people in the community to come and see what we're doing, what's going on, get important information. And again, it serves as a really nice way to connect everybody together. So you've got to have that level of technology behind it. We work off of our basic mandate, which says that there's two types of learning that feed into our interprofessional experiences. This is the typical thing that everybody thinks about with interprofessional education, get everybody in a room together, hearing the same thing at the same time. That is not interprofessional education. However, it is a foundational experience that is actually very important for content and making sure that everybody's on the same page with regard to a basic level of content that will be applied to patient care. So it's an efficient way of accomplishing that foundational knowledge, but it's just a precursor then to the actual interprofessional experiences where all of these groups are learning from, with, and about each other, collaborating together and playing nice in the sandbox together with regard to actually managing a patient. With regard to accreditation, again, the Canadian system was a bit ahead with this. There actually is already a Standard 7 in our accreditation guidelines here, which revolves around interprofessional education and interprofessional practice. So accreditation site visits have been looking at this for a number of years, and you have to demonstrate that you have relationships with the other health professions programs, or you actually have integrated foundational and clinical aspects going on. And again, they're not all strictly interprofessional activities. Some are more foundational, but they are linked to capstone clinical experiences and clinical placements that use that material in an interprofessional environment. And you've got to be able to document that you have students that are developing those connections and relationships with their colleagues in the other health profession schools. Again, in the community, working with healthcare facilities, teaching hospitals, community clinics, you've got to show that your students are actually on teams providing team care in those settings. And then you've got to have documentation of your principles of collaboration with your other schools. So we've been doing this for a while. We're very proud of the way that we're doing that. With regard to the standards that are present in the American system, you've got 6 standards there. I'm going to show you very quickly some of the ways that we've addressed those same 6 standards here with changes we've made to our strategic plan and for our the way that we actually frame our standards when we have a self-study and a site visit. So with regard to mission statement, you've got to have something in your mission statement that talks about the interprofessional patient-centric environment. This is our current mission statement, and what's in red is basically what's been added over the last several years to accommodate a very strong and very direct statement about what we're doing here. Strategic plan, again, we have lots of sections of our strategic plan now that specifically mention interprofessional education in our innovation and change process. We have reward mechanisms associated for faculty working in those areas. We recognize interprofessional education in a major way in our promotion and tenure process. We have interprofessional education as a formal area of research and scholarship for our faculty. Again, with population health and approaches to that, again, everything is structured around interprofessional education and integration with our college units now, and we have lots of interprofessional practice models that are being promoted across the university. With regard to lifelong learning, again, we offer lots of interprofessional types of activities in continuing education now. We have a major dental medical integration event coming up in February that's going to have hundreds of practicing professionals from the community from various health professions talking about oral systemic health and going through patient cases. Our recruitment and retention philosophy has a lot to do with getting people excited about interprofessional collaborations and getting them involved in the interprofessional education program here. And we do have dedicated positions and release time for faculty that are involved in those learning experiences. The organization of the institution, again, standing agenda items on all of the major council meetings and department head meetings and those types of meetings among deans have items about interprofessional practice and interprofessional education. We've got a co-curricular record now for our students that recognizes what they do in interprofessional experiences as part of their transcript. We've got, again, from the financial and human resources side, we've got dedicated positions, and we've got an advocacy program now for getting more resources from the university to support our faculty. We talked about the structure and all the things that go on at the university level, especially the fact that at the highest levels of administration, the activities in IPE and IPP are highly valued, and they count a lot towards what faculty members do. Even for our interview and process for students, we're starting to look at structured interview components that talk about interprofessional awareness and experiences, and we want to bring in students now to our classes that are more aware of interprofessionalism and perhaps better suited to work in that kind of an environment. A Bachelor of Health Sciences program is being established as a feeder for our health professions school, and this Bachelor of Health Sciences program at the university level is going to have interprofessional experiences as part of it, so when students actually reach the point of applying to health professions schools, they will already have a little bit of a background in this, and that's something that we very much want for our student body. All of our course syllabi are being revised to specifically look at IPE competencies and evaluations, and our entire curriculum mapping process has now been switched over to very easily show us where our IPE offerings and training are occurring. Faculty development processes, all of our new hires go through an orientation and training in interprofessional education. We have lots of materials that they get. We have lots of workshops that they go through. And like I said before, our promotion and tenure documents now recognize this as a major area, and we have a minimal level of expectation for everyone throughout the faculty. There's lots of facilities and resources that have been designated to support this, both the informal and formal settings, even social events that we have now to bring our faculties together across the health professions to get to know each other better and support working together. We have designated learning spaces that have been created to support small groups and things that happen with interprofessional activities. We've got student groups that are active, running their own clinics and doing other types of things to promote looking at patients in a comprehensive way. We've set aside travel funds. You'll notice that our faculty that are involved in IPE will be appearing in large numbers at ADIA meetings and conferences and other types of things, because we think it's very important that we disseminate our experiences here and what we're doing. And again, the co-curricular record's been a very important step for us to get a transcript notation for our students that kind of sets them apart and shows that they've done an extensive amount of interprofessional type of training. Standard 5, again, patient care services and our standards of care now. We've got in our documentation lots of things about interprofessional clinics, requirements for students to go through interprofessional types of clinic rotations, looking at our referral and screening and diagnosis and treatment planning and patient care processes to make sure that they support the interprofessional models, and again, specific rounds and case conferences across all of our health professions colleges that incorporate experiences for students. And finally, on Standard 6, which is the research standard, we've got lots of documentation now about how we recognize and value research and scholarship in IPE and IPP, and the types of support that we provide for our faculty in terms of research support, travel support, and other types of infrastructure to support their speaking and publication in these areas. So that's it for me, and I'll turn it back to Laura.
Okay, so that's all really, really important to know, because as a faculty, and I am a faculty member that just had a really keen interest in interprofessional collaboration many, many years ago when it started to come on the radar, but it just, really it just makes sense, doesn't it, to learn about with and from each other so that we work as a team in healthcare. And so it's really important that the university, that the profession, through accreditation, et cetera, really does support this, because the faculty that champion interprofessional education all of them will tremendously enjoy the experience, but will also provide a lot of dedicated time to it. And it almost becomes transformative in the way that you even think or be and behave in your unit, in your classroom, in how you organize your courses. And it's really, really of great value that the accreditation standards also really support that, because it gives validity to what your passion is and your belief system. which is, of course, grounded in the evidence that's out there that working together does result in better healthcare outcomes, quality of care, and workplace experiences for one and all. So this poll here, again, check all that have applied. We sort of introduced you to what's been going on at our university and across the nation, as well as in your nation as well. So which ones do you think apply? Okay, I'm going to stop the poll. And here we see, be an innovator or a change agent within your institution. That's got a lot of attraction. And this is absolutely true. It is truly, truly amazing what happens when you get together with other health professions, the different models of care that they use, that you get introduced to, you introduce them to yours, different assumptions that we have about a condition that we see in terms of a patient or a client and that we're seeing that they see differently. It's very exciting how when we come together and we see things differently, we enter forth with intellectual humility to see those things differently. We do end up being very innovative and change agents. Definite area of scholarship and research. This is a very needed area. There are journals now that are really supporting this. This integration of oral systemic health, that's good that we also see it highly viewed as important because that's our job, right? We bring the voice of oral systemic health into the other health professional curricula. And collaborating with others, etc. So I am going to move us forward into the next area. Oh, there we are. And around, we are faculty. We are the ones charged with having to do this. Can you hear me? Is everybody hearing me? Yes, okay. So I want to introduce you sort of to a glimpse of how, if me as a faculty is going to do an interprofessional learning event with another health unit or several other health units, what would that look like? And so I just wanted to know, before we go there, do you have an interprofessional education office or unit, something like ours or not, in your facility in terms of your preparation? And do you have a mission statement like we shared with ours? Like this is actually leading the whole university. Okay, so pretty much. Okay, so not really for most. That's, I don't think, surprising. And your mission statement, again, not surprising that most people don't have it. I think it's important to have mission statements around that. And so I'm gonna move forward onwards. Okay. So here we are, faculty development. We know we've got the fertile ground, we've got the accreditation supporting us, etc. We are the faculty champions. That's you and I, everybody who's actually down at the ground level, actually creating the garden. And so this would be Doug and myself, Doug Brothwell and myself, who have been very actively involved in faculty development in this area. So here are some lessons in terms of how to go about this. And I always like to start off, and we have lots of faculty across the university who are new to this, but it's really basically, if you want to do something with another faculty, put a call out there. We all have got email systems. We can all put that call out to the various different faculty. You will have something that you will want to work around, embed it into your curriculum. It should be something that's already existing in your curriculum. So look for what is common curricular issues. I mean, ethics, I don't know, I can use the example of eating disorders if you want to get very specific. So something that is common that everybody covers in their curriculum. And then also look at what the interprofessional collaborative learning objectives are going to be. Is it going to be team communication? Is it going to be about roles and responsibilities, or person-centered practice, or team communication? When you receive that call and you get the response, from them, be sure that you allow meeting and time and group process time, because this is very critical, this time period. It's not likely, if you're new to this, that this is going to be pulled off in a week. You probably are looking at, setting yourself up for next September. If you wanted to do something in September, I would start now, put the call out, and allow for group process, forming, storming, norming. It happens and is a definite requirement, because you'll find out that maybe you're not talking the same thing when you all say externships, or when you say patient-centered care. Maybe that doesn't look the same as a next profession of how they're viewing it. So you need to have that dialogue. And then you can move to creating your curricula and interprofessional collaborative competencies, remembering that you're going to do it from a learning objective, which is educationally sound, knowing how to do that. And as well, again, remember when you're developing this curricula that you're going to have different professions in the room. You're going to have different reference points for nurses, and different perspectives from dentists, and theories that social work will bring in, and concepts from dental hygiene, and viewpoints from pharmacists. So this dialogue definitely must take place. Really, I'm opening up at this point for any questions, experiences that you might have that you'd like to share and talk about.
And once again, you can use the general chat feature in the lower portion of your screen if you would like to converse.
Yeah. But everybody's good in hearing me now, correct?
It appears so. It looks like there were a few people that had some audio issues, but you are coming through loud and clear now, from what I can understand.
Great. So this business around here, this is just so important. You put the call out, you find out, you meet somebody that maybe you don't know, or maybe you know them from faculty lounge or something, and you get to talking and say, yes, I teach about an issue. Ethics is stuck in my head. So then you would say, well, let's do that, see if we can do that together. And you allow time for this to take place. And this business about understanding where everybody's coming from the other faculty is very important. So I'm going to move ahead, and if you have questions, please do put them in the chat area, and I think that we will receive those questions and we can respond to them. Is that correct?
That is right.
Okay. So be true to the interprofessional collaborative process. That's the bottom line. This is all about coming to get to know each other, learn about each other, with each other, from each other at a faculty level. You're not even with students yet. You're just being interprofessional collaborators. So once you're established yourself as sort of a working group, then you can decide around the event that you're planning, and know that you need to address a curriculum item, because you're giving some time from your very precious time in your own curricula. You want to know that the learning objectives that you were going to cover on your own in your uni profession will be covered in this interprofessional event. So whether it's cultural safety, diabetes, or any aspect of oral systemic health, or any other area that maybe the other faculty would like to talk about, violence, patients experiencing violence in their home, or whatever it might be, you want to know that those learning objectives will be covered, as well as learning objectives around roles and responsibilities, team communication, that would come out of those interprofessional collaborative competencies. So it's a bit of a balancing act, because it always depends on how much time you're going to devote to this event. But you will develop learning objectives around those two areas, or two themes. Remember, when you're developing those learning objectives, you're going to do them as a collaborative team. So the faculty are present, and you're figuring out how to do that. And so you yourself have to be exhibiting collaborative competencies. You need to listen and acknowledge the other person's ideas without judgment and criticism, be a positive role model, consider the impact of different professional cultures, look at the diversity and uniqueness, be flexible, share your opinion and value, basically create an environment where you can work as a faculty team to develop learning objectives for your student event. And so that's really, really key, that in order for you to be an interprofessional education facilitator, you yourself need to be an interprofessional collaborator. So what does interprofessional education look like? Well, it basically is, by definition, learning about, from, and with each other. to enable effective collaborative care. And this work came out a while back, and it's very much led the way. It's about, from, and with. So, and always, of course, for health and wellness is the ultimate outcome. So what does about, from, and with look like? Because it's both a process and an outcome. So as a process, it's really, really, really critical that in your learning opportunity that you develop, that you are always focusing on what are the students learning about each other, what are they learning from each other, and what are they learning with each other. So, and then you're going to multiply and make this very complex because you're going to do it from various different perspectives, health professional cultures, health professional knowledge bases, concepts and theories and things that make them different than each other. So it does get a little bit complicated, but that's the process of time. So we're going to look at what the learning strategies might be that would be consistent with these processes around with, about, and from. So here we have the balance. We've got person-centeredness around as our collaborative competency learning objective. I've used an example of bulimia nervosa, which is what I had used in March at IDEA. And we've developed, let's say, some learning objectives. And we're really going to focus in on this area for the event because our uni-professionals can deal with other aspects of those common areas. But when we're together, we want to focus in here. That's the valuable time we're spending there. And we're going to use a process that is consistent with interprofessional education, about, from, and with. So we do have to look for what that looks like and what the critical attributes of these about, from, and with, which are actually concepts, and they're actually prepositions in the English language. And as prepositions are about linking things, looking for relationships, even within any sentence that's constructed. So what does about look like? What would be critical attributes about? Well, this is the work of Leslie Bainbridge. She's got several published articles that you can refer to. But key about is roles and responses and contributions. They learn about each other's roles, responsibilities, and contributions, their philosophical approaches, which could be very, very different, and also about preconceived notions and stereotypes. An example is stereotypes that pharmacists are basically pill counters, or dentists are people that only cause pain, that sort of thing. Get rid of those stereotypes because they will be there. What does from look like in terms of critical attributes? Trust in each other, active listening, active reflection, and that it's actually learning from each other is a process, which of course occurs when you establish a friendly learning environment. When we learn with each other, we are doing it because we have a respectful sense of each other, and we want to communicate well, and we want to learn and discover together in terms of transferring knowledge. So those are critical attributes. So when we think about those as critical attributes, and we think, well, what's critical and sufficient if I, as a teacher or a facilitator, want to make sure those are present in the room, then I know I want the students to engage in sharing and seeking about professional perspectives. I know I want them to reveal stereotypes. So I will, in my event, with my coworkers or collaborators, make sure that we allow for that in our learning experience. And we will create a safe and learning environment and explore knowledge bases, and do this in a non-hierarchical way, where all knowledge base is valued, whether one is a med student, or a pharmacy student, or a dental hygiene student, or a social work student. It's all very level playing fields, and respectful of that different knowledge base. So, strategies. Well, if I was going to do about could be, well, Venn diagrams or case studies or discourse. That would lend the students to learn about each other. From could be through discussions, dialogue, discourse would be also welcomed, and with through fishbones or concept maps. And this is where it's important that your university actually has the room or facilities to do this. Whiteboards are awesome. Whole walls that are painted as whiteboards are even better. And you make sure the students have, the markers, and they get up there and you see their thinking out loud by them actually demonstrating their thinking. So from a facilitator perspective, it's always important, because we're developing this skill. This is fairly new to all of us. Not being teachers, that's probably something we know to be, but being a teacher of another profession that is a new culture for us. And so the work of Joan Sargent and all, again, and there's a reference here for you as well, also developed an interprofessional facilitation scale that is based on competencies. It's a validated scale, a 4-point scale, looking at the behaviors of the facilitator. So the competencies of the facilitator, what does that look like? And we use this scale with our facilitators. I introduce them to it, and we start to look at what does that look like using these as our competencies. So here we have our pharmacy faculty say, what do you think those would be? And we have here another individual thinking, well, I know for sure because those attributes are so important about, from, and with. So I guess we should discuss issues related to stereotypes. And we have another individual here thinking, yes, I'm thinking we better celebrate diversity. So already the facilitators are asking, how am I doing now? How am I doing now? How is my own growth and development towards the competencies of facilitating an IPE event? How am I doing now? A check-in point. So competent interprofessional educator facilitators do this. They create learning environments, demonstrating and clearly explaining principles of interprofessional education, engagement, acknowledgement, respect, celebrating diversity. They use learning and facilitation methods that encourage different professions to learn with, from, and about. They value this. They don't just throw the students together. They use icebreakers and games and case studies and group discussions and really very much an interactive kind of setting, using strategies consistent with, from, and about. So what we did is we took those about, from, and with, which are critical attributes of interprofessional education. We took a competency, like discuss issues related to hidden power structures, hierarchies, and stereotypes that may exist among different health professions, and we thought about the strategy using the Sargent scale in terms of our competency in being consistent with the educational strategies. And so what we end up with when we cross those two things is, well, if I wanted students to discuss issues related to hidden power structures, maybe I would have that interprofessional student group draw a picture of how they saw the profession in relation to what they thought others saw with respect to the case. And so now they're taken within themselves as very much attending to the affective aspect of learning. If it was from, maybe a Venn template, and have the students discover what are the common experiences, skills, etc. that they have, and then ones that are distinct to their own profession. And from with, if I use the example of bulimia, ask the students to imagine having bulimia nervosa and wanting help, and what values do they hope their health team holds regarding their care from their profession. Very interesting discussions result. In terms of measuring interprofessional education and interprofessional collaboration, it's really challenging because even though there is literature and it's quantitative, looking at instruments around measuring interprofessional education or collaboration, there aren't that many that actually go much beyond a student or a faculty or a participant giving a perception of where they think they're at. So readiness for interprofessional learning scale is out there, or the interdisciplinary education perception scale. They very much are based on perception. So that's kind of hard when we're thinking about assessing a student's competency, is to ask them, well, where do you think you are now, which is valuable, but not necessarily will their perception actually be indicative of what they actually are doing. So they may think it's important, but they don't know how to do it yet. And so those scales and measurements are really still not yet developed. And in this review of the literature around quantitative measures, there are key issues that keep on popping up. Like we seem to be reinventing the wheel. These two do fairly similar things. There's lack of psychometrics, etc. So this area still is sort of outstanding out there, and it's pretty much uncharted landscape. And this is where scholarship and research is really needed and valued. So any faculty involved in thinking they've got developed some kind of tool or measurement, a rubric, that would be very welcome in the interprofessional literature. So I see we have about 15 minutes left, and that's pretty handy because I'm at the end near here, and I do want to open it up for questions and interaction amongst us. But I wanted to end up here with what our lessons were. in terms of interprofessional faculty. Right from the very get-go, very important that we have that top-down support through, and are very fortunate here at the University of Manitoba to have Tony Acapino, who really, truly embraces, walks the talks, involved as much as anybody else in interprofessional education and modeling and leading the way, and then that the whole entire university does that we have that infrastructure and support, that we're using tools to help that are evidence-based, and that we spend time in that interprofessional collaborative way to establish good learning objectives that are sound and observable and measurable and really consistent with those interprofessional competencies. That you recognize in terms of diversity and marking schemes. You will have a discussion with your interprofessional collaborative faculty, whether it should be pass-fail event, should it be worth 5%. Remember that if a faculty is saying this is part of my course I'm teaching, and that the amount of grade or marks that I give to this particular topic is like 10% or 5% of their overall grade, I can't give that up. I'm accountable to it. And so you're going to have this diversity in marking. And right now, our experience is we just sort of have to accept that there may be differences. Students definitely get to talking, it's only pass-fail for me and it's 5% for you, and then they get a little bit upset. We're still stuck there trying to figure out what next to do. So this perception of equity is very important. And then in terms of that very, very important thing, to evaluate the session process and outcome. Is it effective? Is it transformative? Because it takes a lot of time and people resources. So if it's effective, that's good. And if it's transformative, that's really where you're headed towards. And the fact that it has to be, sustainable, that you have to build capacity and sustainability. So having the buyout time is important as you develop interprofessional learning opportunities with others, because it does take time. And then, of course, share, and that would be your scholarship. So we did develop a model, and this sort of wraps it up in terms of start off with your concept and your purpose of your interprofessional event and who will participate. Invite, put the call out there. Maybe it's just somebody you always go have lunch with, and just say, what can we do? Get together, allow process and time, so that group process around interprofessional collaboration, learning objectives, and competencies. So learning commons, whatever is existing in your curricula, don't create new, just look for what's there. We can do this together, and then team it up with an interprofessional collaborative competency, person-centeredness, team communication, role, conflict resolution, etc. Have a means of assessing participant learning. Spend some time there. What exactly are you trying to assess, and what are you accountable back to your respective curricula? And as well, the means of evaluating the event. And Kirkpatrick is another one that we use in terms of Kirkpatrick's level of learning outcomes, and we often use that scale to measure it. And then interprofessional facilitation, about, from, and with. This is where you're going to spend some fun time deciding what strategies you should use. Be consistent with about, from, and with. And the slides are there for you if you want to go back to and refresh yourself around what does about look like, what does from look like, what does with look like. It has to be very important, because those are the attributes of interprofessional education. If you don't have about, from, and with, you do not have interprofessional education. Get your facilities and resources in place, implement the event, assess the learners, and evaluate the event. And then, as you can see, it goes around and around and around. So focusing on about, with, and from. So, last participant poll. Feeling more confident. I don't think that this means that you're going to go out there and actually do an event, but that you feel like you have a little bit more understanding about the whole experience and what some next steps might be. I know that we are very, very excited in our university to share our experience with others, and we're here for one and all, and happy to do so. So we have, is everybody entering in the poll? Yep, very good. So we've got, I think, for an hour, a webinar hour where, we are trying to interact with you. I think those are really nice results in terms of you're feeling a little bit more confident. We've tried to provide you with some principles about how to go about this should lead the way in terms of the value. Some structural, very helpful support issues that, start wherever you can, but, start to see where that support can come from. And then to give you a bit of a framework, very basic, I think, still to how to develop an education event. And, the education event very much looks like this, doesn't it, right? What are we going to do? How are we going to do it? Where are we going with it? Objectives? How are we going to assess? How are we going to evaluate? What strategies will support these competencies and learning outcomes? What resources are available? Do it and assess it. We welcome some more questions.
All right. At this time, if you have questions, simply prepare your question in the general chat feature at the lower portion of your screen. All you have to do is type your question in and simply press Enter or click Send to submit your question.
Mm-hmm. Yeah, so
we do have some people typing, I noticed. So at this point, they're just simply getting their questions together, and I see that we had a question come in.
Okay, I would like to know more about how you objectively assess the students for IPE activity. You mentioned a name that you use. We use the Kirkpatrick, K-I-R-K. I guess I could type that in, right? Sorry, here it is. I'm typing on from a side here. Patrick. Evaluation. I'm not maybe going to get this exactly right. Of learning outcomes. It came out of more the business world, but it's been embraced in the interprofessional education community through the joint education group that had way back when, probably about 5 or 6 years ago, had looked at how do we evaluate interprofessional education. So Kirkpatrick evaluation, if you Googled that, it would come up for you. And so Kirkpatrick's evaluation learning outcomes basically has 4 or 5 levels. First level is, do you evaluate the event in terms of people's perception? Oh, that was good. That, what could be better about it? And then do you evaluate your learning outcomes in terms of students or participants' knowledge base? And then another layer about their values, beliefs, attitudes base, and then their skill base. And then the next level is, does your event evoke actual behavioral change in your participants? And then next level, I believe, is organizational structural changes. So there's been a shift. As we would say, example, here at the University of Manitoba, we have an IPE initiative of structure, so there's been a humongous shift. And then ultimately the last level is, what impact does this have on the healthcare outcomes, quality of care for individuals? So we use that, we decide what level we're going to work at. Usually we work at level 1, level 2, and level 2B because we're talking about students and they're learning around these competencies.
I see another question about estimating the number of FTEs that we're devoting to IPE. Best estimate at this point, probably each of the health professions faculties is devoting 2 FTEs of faculty and administrator time to the effort. The university on top of that is throwing in an FTE for a coordinator overall and an FTE for support staff. And we're actually looking to increase those FTEs across the board as we get more involved now in actually implementing a lot of programming. We've come to the stage where we've trained lots of facilitators, we've developed lots of themes, and we're actually now implementing the programming. So we're going to have to spend some more FTEs on making sure that that goes smoothly.
And unfortunately, we are all out of time, and that is going to conclude our event, Preparing Faculty for the IPE Curriculum, Transforming the Learning Landscape, brought to you by the American Dental Education Association. Our speakers were Professor Laura McDonald and Dr. Anthony Iacopino. Dia will appreciate your filling out the evaluation for this webinar. You'll receive an email message from KRM with a link to that evaluation. After filling out the evaluation, you'll have the opportunity to download and save a copy of your CE verification form. If you're participating as part of a group, you will need to add your name and email address to the site roster in order to be sent the evaluation. Any questions, please call KRM Customer Service at 800-775-7654. When we get disconnected today, you will automatically be redirected to the site roster in the event that you were unable to submit your information prior to the start of today's event. Today's program is copyright in 2013 by the American Dental Education Association, all rights reserved.